I'm here with Nancy Huber, who is a physiotherapist here in Goderich, and we're going to interview her, and here we go. So, what educational path did you need to take to become a physiotherapist? Did you go to college or university?
I went to university. When I went, you had to have a year of university before you could apply to physio. But the way it is right now, it's a master's program, so you have to have a university degree, and then you can apply for physio.
So, could you describe the program that you took?
It was a practical course. Physio is a very hands-on course, so when I got into physio, before I actually got to school, people had told me that you actually practice on each other, and sure enough, you go into your labs and you have to put on your shorts and t-shirts and you practice on each other. A lot of theory as well, very intense. It's a tough course, but it's fun. Yeah.
Awesome. So, where are you located and what specific duties does your job entail to do?
I work at the hospital. We see inpatients and outpatients. So the inpatients are the ones that are in the hospital for whatever reason. It might be failure to cope at home, so it's helping to strengthen them and helping them to walk, get them back home again. Maybe surgeries, maybe strokes, things like that. Outpatients, it might be surgeries, just different injuries that people have had, pain, back pains, neck pains, things like that.
So is working at the hospital, like for a physiotherapist job, is it different than working at a clinic, or is it the same?
You tend to see a different patient population. The hospital is generally an elderly, what we would see as an elderly population. A clinic would see more your working class or a younger population. Just because clinic is a self-pay or people with benefits, so that's why it's more your working class. The benefits are going to pay for it.
Okay, so do you work mostly with elderly people, disabled people, or people who've been in like accidents or anything like that?
I actually work with all of that, but generally mainly the elderly. Somebody who's in a severe accident, who's admitted to the hospital with several fractures, we'd be seeing them. Your elderly, as I say, failure to cope, so just not surviving at home, and so they just need help with that. But mainly elderly in the hospital.
Awesome. So what personal qualities are essential to be a physiotherapist?
You need to be able to make decisions. Sometimes for the patient, they need help to make the decision. You need to be able to problem solve. You know, they come in, you need to assess them, you need to see what's all wrong and figure out what you can do for them. You need to be able to communicate, talk to people. You need to be compassionate, and you need to enjoy working with people.
Awesome. So what physical qualities do you have to be able to be a physiotherapist?
You need to be generally fit. You need to be able to stand, walk, lift. It's hands-on. You need to be able to use your hands. Pushing, pulling wheelchairs, things like that. So just a general physical fitness.
So do you work independently or like alongside other people?
Both. I work, when I'm working with my patient, I generally am working with them by myself. But in the hospital, there's also the huge team approach, so we'll get together and talk about the patient, you know, how they're doing, how we can get them back home.
So which aspects of your job do you like the most, and which ones aren't really a favorite of yours?
Most I like to see people getting better, and I like the feeling that I've helped them get better, and most people are very appreciative of that. The least, of course, is all your paperwork.
Okay. And what emotional implications do you have with your job?
It's just you get involved with your patient because you work one-on-one with them, and if they have a lot of health complications, a lot of problems, you get involved in all that. As I say, you're working closely with them, so you want to get them better, you want to get them back, and you spend a lot of time talking with them.
They become like a family.
So yeah,
almost,
you get to know all about them, and likewise they get to learn about me as well. So we're just sharing personal things.
So do you have flexibility with your job hours at all, or are they pretty strict?
Somewhat in the hospital, because they are becoming more flexible. Generally our department is open from about 7:30 in the morning to 5. So they will let me adjust my hours if I have an appointment or something like that. I can adjust my hours, but within reason.
Oh, that makes sense. Yeah. So does the knowledge that you have gotten from working as a physiotherapist help you with your daily life with injuries at home, to your boys? Or
Like Jamie with his sports my husband with his aches and pains.
Exactly.
They would give you a different answer than I would. Yes, it does help, and people will come and ask me different things, and yes, it helps.
And is there any opportunities for advancement in the field, or are these advanced, do they require further studies to advance?
We are always taking different courses on weekends, or it may be a very clinical course, something that I can use when I'm treating my patients. There is more the administrative aspect of physio as well. Within physio itself at the hospital here, there's not a lot of advancement. More in the city hospitals there would, because there'd be the department head of looking after all the physios, and then, as I said, there's more administrative type jobs as well, looking after several departments, but I'm not interested in any stuff. I need my job.
And so what initially made you become a physiotherapist?
I was interested in sports, being active. I did not want to sit. I wanted to work with people. Just I enjoyed the active lifestyle, and I want to keep people active.
Yes. And what advice would you give someone who would be interested in this profession?
You need to be interested in people, interested in helping them, have an interest in health. You need to do well in school, and it's fun. It's a fun job. Yep, constantly learning.
And I have a question actually. What school did you go to become a physiotherapist?
I went to University of Toronto.
And did you like it?
It was a change. I grew up on a farm, so it was quite funny when I went there. A lot of the other students in my class came from families of doctors and people in the health profession. My dad was a farmer, so when I went to Toronto and met kids in my class, they didn't even know of a farmer, so it was quite interesting. And Toronto, just coming from a farm in downtown Toronto, was a bit of a change, but
Okay.
it was fun.
Thank you for your time.